Okay, so slurp of the coffee and on to, I believe, is going to be quite a short reflection today. So today I thought for this video I would look at a very specific event that happened on Friday. It's not a massive event, but I just thought I'd reflect on it because I think it is a good example of where you potentially are as a third year, and maybe if you're a really good experienced and have had previous experience as a second year, compared to where you are where I was when I first started with physiotherapy. So brief background: when I started my physiotherapy degree, I had absolutely no healthcare experience in a working way. I'd got this theory behind me a little bit through interest, a previous biology degree and things like that, but no real working experience working with patients. So that meant that it's all been quite new to me in terms of patient interaction. So this event on Friday is with a patient that I've used in some of my other videos a fair bit, because they're someone that I've seen right from being on ICU through to the wards, had significant improvements compared to being extremely unwell when I first met them. And they were in hospital for a little while before that. So with that in mind, this is just basically about progressing a patient's mobility, and also as a physio student I want to use the word be brave, and I think it's the right word, but sometimes that might bring about an idea of taking risks, which we do as physiotherapists, but I want to be careful there, just to sort of put the caveat on all of this to say that I'm not going gun-ho and all of a sudden taking lots of risks with patients. But what I found that I did on Friday was be far more aware of the assessments that I'd done informally, and I just mean that on previous attempts at mobility with this patient, to inform what I potentially could do to push this patient a little bit further. So what I did with the patient is kind of irrelevant. This is all about sort of my confidence in with the patients. So cutting a long story short, the patient had previously stood very reluctantly. There's a lot of anxiety, and this patient is very scared. And that's really hard to get across in a video, because you kind of have to sort of be with that patient to realise the significance of that, and that's really, really important to me, building up a rapport and being able to work with this patient. But I had an opportunity. I wanted to progress this patient. I'd looked at starting to look at discharge with my educator, and trying to push that on now as I finish my second week, really going into these final 3 weeks pushing discharge. So I had that in the back of my mind, which again I thought was good, and I use that to think, well, if we're looking to discharge this patient to the best place possible, i.e. home, next week, we need to get a lot further than we are now in terms of their mobility back to baseline. And I knew that the patient could. It was very much being limited by anxiety and fear. So I went in with the idea that I was going to quit the Arjo and go straight to now a frame, and I thought we'll see how that goes. But from my assessments beforehand, I had the gut feeling that I thought we could do some walking today. Not done anything like that so far, so it was quite a bit of a jump. Got there, the patient was sitting out of bed, needed to go to the loo. Nurses were about to do all of that, and as a student, you're very easily led by what's going on around you. And for the first time, probably, I had the confidence to say, actually, we need to do what we need to do. Obviously, I spoke to the patient about that first. I needed to get a bit more of the social assessment for discharge planning, so I did that. And then once I'd done all of that, I just grabbed the frame, I put it in front of them, and I just made no big deal out of this at all. I barely even mentioned the frame, and we just went for a stand, because all of the other times you dwell on something with this patient and it becomes a bigger deal. It becomes more scary. The fear and anxiety builds. So I thought, let's try and eradicate all of that. So we just went for it, and it worked. Stood first time really well. It's the first time that's happened. Straight away, the patient, like before, was sort of quite enjoying being stood up, as patients do. And then again, made no real big deal of the fact that I thought, right, let's take a few steps. And it worked. It was fine. We didn't walk far, matter of a few meters. But what it proved to me was that I can take risks. Just on that as well, actually, I was on a bit of a roll, so I got the patient stand independently with hands off the frame, which was, you just know, I'm beginning to get a gut feel of what I know a patient's going to be able to do. I do it in a safe environment. There was two of us, not needed, but I was using one of the healthcare assistants with me. So I knew that it was a safe environment to take a calculated risk to progress that patient for their benefit, to enable a better discharge next week. And I'm so glad we did it. It proved to me that the patient is able to stand independently, albeit for a short period of time. And that's, I think, is just conditioning. Able to walk with the frame. So that's great. And standing now first time, and standing independently to the frame as well, needed no support. So that means, because I pushed to do that, on Monday we're one step ahead. And that's the other thing, because it was a Friday, I knew that it was the weekend. I knew this patient potentially wouldn't get any physio intervention over the weekend, and we could be just trying to, we'd always be on the back foot. So push forward. Monday now, my plan is to, again, now I've got that discharge sort of previous ability really honed in, we know where we need to be. So on Monday, again, it's going to be frame, stand and walk. And I reckon we can walk, turn, transfer on Monday. And if we can start doing that, I can then start assessing that patient's ability to go home rather than into an intermediate further rehab facility, which this patient was adamant that's not what they wanted. They want to go home. They want they want to be with their husband. They want to get back to there, and that's my aim, and that should be my aim. It should be my aim to do what's realistically likely for the patient's best interest. So really happy. I'm going to keep it at that. It's AHP #AHP Day tomorrow, and my task tomorrow, I've set myself, is to interact indirectly or directly with as many of the 14 AHPs as possible. And that can be, I might just try and say hello to them, introduce myself, talk to them. It may just be as simple as, when reading patient notes, looking through and taking a bit more of a note of who has been involved with this patient. So, when I'm reading the notes, I can see, so the dietitian has been involved here. What have they done? And a bit more outside of my scope, but just take a bit more of an interest and be a bit more aware of what my fellow AHPs are doing. Podiatrists. I'm not sure I'm going to get to the art therapy and dance therapy. Never know though, because some of those things might be fantastic for someone with COPD, anxiety, things like that. Probably, I'm taking a wild stab in the dark here, but I can imagine they are incredibly underutilized. So I shouldn't imagine I'm going to see it. And also, given the setting, potentially hospital notes, I'm unlikely to see those sorts of things going on. But let's just see. If I've got my eyes open to something, I'm more likely to see it. At the moment, I think I'm at risk of being a bit blinkered looking at what I need to see. So that's fine. And my educator's keen for me to be able to prioritise what I'm picking from the notes, but being thorough. But I don't think one day of being a bit more aware of the allied health professionals involved in patients, I don't think that's going to have any harm on my placement. So that's tasks. So I'll be back tomorrow just to see how many. Some people have said they've made a guess on Twitter that I might see 9. I think that is pushing it. I'm going to count physio though, and I'm working with OTs, so I've got to find some speech and language therapists and some podiatrists, some dietitians, and I'm getting there. And just spread the word. Okay, so hopefully that's shorter. We'll see. Thank you very much, and I shall speak to you tomorrow.